Gout is on the rise around the world, a debilitating disease that affects the joints. Here to share the link between kidney health and gout is Dr. Jessica Coleman, a specialist with Nephrology and Hypertension Medical Associates. It's good to have you with us.
Thanks so much for having me.
So what is gout exactly?
So gout is interesting. It has a lot of different definitions actually, but at the crux, gout is essentially when your body either makes too much or accumulates too much uric acid. I tell my patients all the time that uric acid is a true waste product. We can't use it. So we have to eliminate it through the body, and the only way to eliminate it is through the kidneys.
Yeah, right.
So when we see an over kind of abundance of uric acid in the body, I kind of use the analogy of, we all have that one closet in our house or that one room in our house where when unexpected company comes over, all of a sudden we grab everything. That's exactly right.
Yeah.
We throw it in there and we shut the door. So the body looks to do that with uric acid. It can't utilize it. And if it can't excrete it rapidly enough, it tries to just pocket it away, shove it away.
Now, if you drink enough water, if you stay hydrated, does that help the function?
Certainly helps. Absolutely will help.
Eliminating it from your system?
Correct. Helps the function of the kidneys,
well,
helps
we're not so
eliminate.
Good at that.
But we're not very good at that. And also, to be honest, that's not the full story. Because when we see this accumulation of uric acid, typically speaking in the joint space, right? That's what is classically associated with gout. We see this very inflammatory, very painful, swollen joint. And it can even develop into a chronic arthritis condition. But we also describe gout as a systemic disease as well, because it has implications for cardiovascular disease, kidney disease, and these can be self-perpetuating, almost snowball effects.
Yeah, when you think about any kind of acid building up in your system, it's not a good
thing.
So uric acid, of course, sounds like urine. So
correct.
So,
yep.
and that,
so it's
and
an
that,
easy.
Yeah, and so that means that the kidneys are involved. So it's National Kidney Month. So we want to talk about healthy kidneys when we're talking about gout. And so it can be hereditary, but what are some of the reasons why millions and millions of people all over the world and here in this country are developing gout?
Absolutely. So there's a lot of different reasons. To your point, hereditary absolutely is a factor. But we also have a diet that tends to be very rich in what we call purines, and that's the precursor molecule to uric acid. These exist in things like red meat, seafood, beer, wine. There's a reason why this used to be called the king's disease, in other words.
Yes, of course.
So,
we've heard that, of course, yes.
Right, yep. So there's a reason for that. And we think it's really multifactorial, honestly. I think sedentary lifestyle has a lot to do with it as well. We also know, though, that just having cardiovascular disease, hypertension, and certainly kidney disease can lead to gout. So again, why it's such a pertinent topic in March of all times.
Right. So how do we become more proactive in our own health, our own advocate?
Very easy answer, which is just first and foremost, have a great primary care provider and have a good relationship with them. Make sure you're getting your annual physicals. Make sure that you're having blood work drawn.
Does a blood test detect a high uric level?
It can. Okay. A simple blood test will first and foremost, just a metabolic panel will inform your primary care provider or, of course, gout specialist what your kidney function is and really how to help risk stratify as far as kidney disease goes. But secondarily, you can absolutely get a uric acid level as well. And again, that's just a simple blood test. Now, the trick here, though, is that, again, using the analogy of the house with, the clothes and all that you've kind of thrown away into the closet, is that if the body has actually just deposited those clothes, right, the uric acid into a joint space or into the cardiovascular, the heart tissue, or wherever it's decided to deposit it, the problem is that your uric acid level may actually be low or normal, and you may still actually have gout, and or you may at least have the propensity towards gout. So I really educate, and I enjoy educating patients and really kind of empowering them to educate themselves about gout, to talk to their providers, talk to their gout specialists, whether it be a nephrologist or a rheumatologist, and do ongoing kind of monitoring.
Those aches can be more than just an ache.
Exactly.
Well, thank you so much. I really appreciate you going through this, Doctor.
Thank you for having me. I appreciate it.
Great to talk about it. We'll be back after this.